Thank you for joining our very first Mental Health Inside Out series. We really want to thank Advanced Health, Coos County System of Care, for being here to join us on our panelists. My name is Summer Faruqi. I am ADAPT's Public Relations Specialist, and I'll have the rest of the panel introduce themselves.
I'm Trisha GeDeros, and I'm with Coos County System of Care.
I'll go next. My name is Erica Ishmael, and I'm with ADAPT's Adult Mental Health Program.
Hi, my name is McKenna Davis. I'm a therapist over at Three Rivers Health Center in Coos Bay, Oregon.
Not really a panelist, but I'm here. I'm Kira Hood, the Director of Behavioral Health with Advanced Health.
And I'm Sam Baugh. I'm the Community Engagement Manager for Advanced Health.
Awesome. Thank you for being here today. Today's topic is really to introduce the basics of mental health. What is it? What can people do to get support? What would that look like? So I'll go ahead and begin with our first panelist, Trisha, to introduce this topic to us.
Thank you, Summer. So this first slide shows the data from the Oregon State University's Coast to Forest project and shows that Oregon ranks as the 6th highest state in the country for the prevalence of mental illness. Between 2019 and 2022, there was a noticeable increase in the number of people diagnosed with a mental health condition. The good news is that there was also a slight increase in the number of individuals getting mental health treatment during that time. These bar graphs compare the percentage of adults experiencing symptoms of anxiety and depression in Oregon versus the United States overall. The graph on the left shows that 35.3% of adults in Oregon report experiencing symptoms of anxiety or depression, which is slightly higher than the national average of 32.3%. On the right, the second graph looks at adults who not only report symptoms of anxiety or depression, but they also report having unmet needs for counseling or therapy. Again, Oregon is slightly higher at 32.4% compared to 28.2% across the US. And this graph shows how common symptoms of depression were over a 2-week period among people ages 12 and older. Overall, 13.1% reported experiencing symptoms of anxiety or depression. And the data also highlights that these symptoms were most common in adolescents between the ages of 12 to 19, with the prevalence decreasing steadily with age. The graph on this slide on the left shows the prevalence of depression has increased over the past decade from 8.2% in 2013 to 13.1% in 2023. And the graph on the right highlights the impact of these symptoms, with 87.9% of people diagnosed with anxiety or depression reporting that symptoms made it harder to function at work, in school, or in other social settings. So what can be done for you? Depression symptoms are common and also treatable. Support is available through therapy, medication, or a combination of both. If you or someone you know needs immediate help, call or text 988 to reach the Suicide and Crisis Lifeline, or some local agencies also offer walk-in crisis services. For medical or psychiatric emergencies, dial 911 or go to the nearest emergency room. With that said, therapy can take many different forms, including individual or group sessions, and there's also various approaches depending on your needs. Both individual and group therapy can help better understand your thoughts and behaviors and support you through difficult life changes. Group therapy also offers a unique benefit It connects you with others who may be experiencing similar challenges, creating a supportive, peer-based environment led by mental health professionals. In addition, peer support, whether in person or online, can be a powerful tool for healing and connection. Care teams play a vital role in mental health treatment by offering coordinated, comprehensive, and accessible support. Mental health care isn't just the work of one provider, it's really a team effort. A team-based approach brings together professionals from different disciplines to collaborate on care. This improves efficiency, enhances patient satisfaction, and also strengthens crisis intervention. By working together, care teams can create a personalized treatment plan that is tailored for your unique needs and goals.
Awesome. Thank you for sharing the data with us. Up next, we'll have Erica Ishmael.
Awesome. I'm going to share my screen. Oops, go back. All right. So we're going to talk about who needs counseling, how to access it, and what that might be like.
Erica is not sharing.
Okay. How about now?
Yep.
Wonderful. Okay. So having emotions is a very natural, healthy part of life. We all experience sadness, anxiety, stress that show up when especially life gets difficult. There's various things that can happen like job loss, relationship changes, health problems, or even trauma. But when those feelings become too big to manage, they start interfering with our life, or they are persistent, they really don't go away. It might be time for us to look for extra support. Some things that we might notice when things are getting to be too much is when we are having a hard time sleeping or eating too much or not really having an appetite. If there's a loss of interest in things you used to enjoy, if you really used to like going hiking and now you don't really find yourself doing that anymore, that could be a sign. Some people say they even feel numb, flat, just kind of blah. Sometimes when we're not okay mentally, it can start showing up in our physical health. People might start having headaches, stomach aches, or even feeling sick. And then people might start drinking more than they used to, or start using even drugs when that's not really something that they used to do. Ways to ask for help. One thing that you can do is check with your insurance. Usually there's like a list of covered providers. Sometimes you can even call and talk to someone directly to find a therapist that focuses on exactly your needs. Another thing you could do is talk to your primary care doctor and ask for a referral. Some workplaces have EAP programs that you can call. Usually there's a set number of sessions that you can have. If you are involved in school or in a community faith-based program, there might be a school counselor or a faith-based leader that you can talk to who might be able to point you in the direction of finding a therapist. Sometimes just an online search might be able to find someone local or someone who specializes in the things that you're struggling with. And then there's always the crisis lines available. I think each county has a specific crisis line to their own, but there is the 988 number that is nationwide that we can contact anytime we need crisis support. What to expect in therapy? Usually the first session consists of paperwork, consent forms, and then getting to know the therapist and them getting to know you and what's going on with your life. Some things that people can expect from therapy would be talking through things in a safe environment that's free from judgment. Therapists might help you explore different perspectives, patterns, things happening in your life that you might not have thought of. In therapy, you can learn tools like relaxation, mindfulness, healthy relationship, communication skills, work on healthy relationships and self-confidence, including the relationship we have with ourselves. They might teach us things and provide education about mental health, and provide feedback. It's important to remember that therapists don't fix people and we don't have all of the answers. We like to guide or walk alongside our clients and help with support and give space to grow. Therapy is most effective when we take what we've learned in therapy and we apply it to our daily life. Practicing skills on a regular basis, taking time for self-care, interrupting those patterns that have been identified in therapy, trying out the tools, maybe new communication styles, speaking honestly with your therapist about what's working and what's not working. Maybe certain things aren't realistic for you outside of the session. And then it takes time, it takes effort, but that is always what's needed for things to grow. Staying the same is often a lot harder. So in summary, emotions are normal. We all face challenges, but when things get to be too much, it's time to reach out. There are different options in reaching out and finding a therapist. Therapy is always a process of building trust, exploring things, and growing at your own pace. It's okay if the first therapist isn't a good fit, keep exploring. There's various different types of therapy and different modalities. Growth can be hard, change is hard. It's a lot easier to stay the same, but then we don't grow, things don't change, and we all deserve to grow and change and lead the life that makes us happy.
Awesome. Thank you, Erica. I really appreciate it. All right, so we will open up for Q&As. If anyone has any questions, I'm sure I would love to hear from Sam and Kira on how one can start therapy at Advanced Health.
We have several options here in Advanced Health for therapy. Therapy is a covered benefit for all OHP Advanced Health members. Outpatient therapy provided by an in-network provider. You do not need any sort of referral or kind of a referral from your physician or prior authorization. You are just allowed to go to see whomever in network you would like to see for your mental health issues. So that's a great benefit. Rides and transportation can be worked out as well through Bay City's ambulance if you're in need of ride services. For out-of-network providers and a lot of telehealth, if you're struggling to find a therapist locally, we are allowing telehealth providers from out-of-network. That does require prior authorization from that provider, but to date, we have not declined or denied any authorizations for out-of-network therapists to date. So please don't just assume that that's not an option. It is. I would like to direct everyone to the Coos and Curry Community Mental Health Hub. The website is www.cooscurryhub.com, and I was just taking down all of those. I'm gonna copy that and put it in, send it to Trish so that she can put that in the chat. I don't know that I'm able to do that.
That's cooscurryhub.com, right?
Yeah. So I have it that I will be putting into the chat for you. If you struggle further with finding therapy help, you can always call Advanced Health customer service, and they will help you and or forward your message to myself. And I have done several one-on-one kind of research projects, trying to find the right types of therapists for the different issues that our members are struggling with. Happy to do that as well. So we really encourage people to utilize those services. And like I said, the transportation is also covered as well. So we try to break down all barriers to get mental health services. If you run into barriers, I would love to know what they are. Does anybody have any questions about that?
I don't see any questions, but feel free to put them in the chat if you have any further questions. We actually got a really interesting question. How do y'all feel about the utilization of AI as a mental health aid?
Can I start on this one?
Yeah, thanks, McKenna.
Yeah, it's really funny. We were actually just talking about this in my workplace today. I'm a therapist at Three Rivers, so we have a team of therapists there. And there are a couple like news articles out just this week about people who really, I mean, tragically died of suicide after trying to use AI or ChatGPT or basically LLM, whatever the LLM is for a mental health aid. So they were saying like, I'm having thoughts of suicide, what should I do? And apparently in some scenarios, the large language model actually advised them to hurt themselves. And I think that at least one person actually died by suicide after that. So I think it is dangerous, and I think you have to differentiate between like, when am I using this as a tool for personal growth? Maybe for like journaling prompts or thinking about different areas of my life. And when am I actually like seeking clinical support where I need to have a human who's been specially trained who can help keep me safe? I don't know that I actually haven't even read the article. I had a busy day, but my boss did send it to me, so I'm curious to read it. But yeah, I don't know the answer to that question.
I would also like to say, we have crisis walk-ins, both in Coos and Curry counties. And so, we really encourage individuals to get that one-on-one, face-to-face, contact, human contact, initially, especially during a crisis. I feel like I need to say that the emergency department sometimes isn't the best place to go for maybe mid-levels, but if you are suicidal or actively thinking about harming yourself, please go to your nearest emergency department. That said, going to a walk-in crisis at either ADAPT or Coos Health and Wellness is an option. And again, I just have to say, transportation is supported and covered by your OHP benefit to get there.
I also did have something. I am not a panelist. Hi, folks who are listening. I'm Greg Garris, the communications director at ADAPT. I had something to throw in with this related to just kind of the technical aspect. Most existing AI platforms at the moment are generative AI solutions. They are not truly thinking programs, entities, or anything like that. They are trained to essentially read through transcripts of already transcribed documents, books, stories, just pre-written human content, and then just generate a most applicable response. That unfortunately lends itself to a significant risk when you come into real human situations, because something that is simply reiterating previously existent information as a what is the best way I can respond to this, or what is the most common response that other humans have given to this, is not always the most appropriate thing. There are a number of solutions currently existent on the software level for that. However, even as they are currently sold, there are a number of legal disclaimers that come with them acknowledging that the patient or the entity promoting the use of that service is doing so at their own risk, which is just from that disclaimer itself pretty blatant that they know that it is a risky thing to do. So until or unless solutions reach a point where they do have the capacity to consider real world circumstances, They are not truly responding to you as an individual or your situation. They are providing a broad scope summary of what most people have had a positive feedback for. So just wanted to throw that in there.
Thank you, Gray. That was so much better than my answer. That was very illuminating.
No problem.
Erica, I was wondering, based on your experience being an open access therapist, what nerves do you see when clients are first seeking for mental health help?
What do you mean nerves?
Like, are they nervous? Are they coming at a time where it's already past a certain point of emotion?
I see a lot of, so for folks who are in here, I do something called open access. So anyone wanting to start counseling, they can walk in and receive a mental health assessment same day. I often see folks who have been putting it off, like, oh, I'm not that bad, I don't need to go in yet. Or I see folks who are like, I know I'm gonna have to go in and tell my story, and my story is really painful, and I'm not really ready to open that. Sometimes I feel like we avoid to cope, and then having to come in means they have to look at it and sit in that discomfort of those emotions. I also do meet some people who are like, are you going to lock me up? And I'm like, no, absolutely not. You know, as long as everyone's safe, you know, that is absolutely not going to happen. I talk about their rights and things like that. First, I don't know where that narrative comes from, that people think they're just going to get locked up in a room somewhere and they're just going to be stuck there, but people are terrified of that. It's not that often, but I mean, probably at least once a month, somebody comes through open access and they're terrified that I'm just going to call the police and lock them up. And usually they're not even like, they maybe might have some suicidal thoughts, but there's absolutely no danger happening. I'm not sure where that fear comes from.
Can one of you also expand on what patient confidentiality um means to someone who might be starting therapy, what that protects?
I'm happy to speak about that. I'm a nurse by trade. I worked at Bay Area Hospital for 24 years prior to coming to Advanced Health and ran the acute psychiatric unit. And I told my staff constantly, if you do not have the trust of your community members, that their information is 110% safe with you, you do not have a job. The unit will not be successful, patients will not come, that people's individual stories are our gift. It's like a gift to us and we need to protect that gift. We're being trusted, and I always took that to, I think that was probably one of the most important things that I did, especially from being from such a small community where, you know, everybody knows everybody, it seems. It's even more important that people's information, what they disclose is confidential, never gets out, is always between the provider and themselves. And I know that the individuals that I've worked with have always held that same standard. So we understand that is very precious. You're giving up sacred information, and that we need to protect that with everything we have.
And when I meet a patient for the first time, I usually talk about, you know, times when I would have to violate confidentiality, just so that we're on the same page about that. So I'll usually say, like, if I think you're gonna hurt yourself or someone else, or if I hear anything about child or elder abuse, then I legally have to report that because I'm a mandated reporter. And because I work as part of a primary care team, I'll usually also say, like, hey, I might share information with your doctor if we need to pass that information along for your healthcare. And people are usually totally fine with all of that, but I like to be super upfront because there are limits to confidentiality, and they are a little bit different for each profession.
Absolutely. Yes, very true.
Thank you for answering those questions. Um, I also wanted to ask, what are myths or false claims surrounding mental health and access to it, specifically in Oregon?
Summer, can you repeat that question?
Yeah, absolutely. What are myths or false claims surrounding mental health and access to it in the state of Oregon?
Probably that we have enough providers here to meet the need.
Yeah.
Myth.
That's a myth.
That's a myth.
We also received another question. What metric do you use to decipher if the person is really gonna hurt themselves, or is it just talking about it? And is there a metric or signs that y'all look out for?
I can speak to the one that we use at Adapt. So we use something called the CSSRS, which is the Columbia Suicide Severity Risk Scale. It asks, I posted it in the chat. The kind of three things that we look for is there thoughts? Are there plans or thoughts of how they might move forward? And then is there intent? Have they started planning out moving forward? Those are kind of the three levels. And then kind of exploring like safety planning. Are there things that we can put in place to keep them safe, or should we talk about, do they need to talk to a crisis therapist or maybe even go to a hospital? So at Adapt for open access, this is one of the screeners that every client gets. And usually if their screeners are high, indicating that yes, they do have plan, I don't even usually see them. They go straight to a crisis therapist. If in my office, when we're doing the initial assessment, maybe they've had thoughts, maybe they've even started thinking about moving forward, we are doing safety planning. Are there other questions or parts that I didn't explain very well?
Oh, that was good. Thank you. Alrighty, we'll take another minute to see if anyone from our audience has any other questions or if there's anything y'all would like to share.
I think it's changing. I'm still pondering the whole myth thing. I do believe that mental health treatment is becoming more and more people are more open to reaching out and getting it. It's becoming more common. It's becoming less stigmatized. But I do want to say that, you know, if you need to hear it, reaching out and asking for help is probably one of the strongest things you're gonna do as an individual. A lot of people do see that as a weakness, that they are unable to manage their feelings on their own. And I am glad to see that I think I do see more and more people reaching out and asking for just that ear. And sometimes it's an ear. So just not just listening and getting it off your chest is important. So I think a myth is that you're weak. There's nothing weak about taking that step to get any kind of mental health treatment. So I think that that's a myth out there. And I think we're all just, people ask me why I got into, psych in the first place and how did I do that? And on the acute psych unit, what was I doing? And I said, I think we're all a heartbeat away from that one instant moment or instant in time that can change everything. And right now I'm at a place where I can help you through your crisis. And tomorrow I'll probably, who knows, I could need, your shoulder to lean on through my crisis. So I think we're all just, just a heartbeat away from something that changes drastically in our lives, and we need to look at it that way. Those federal budget cuts in mental health.
Yeah, so we received another question from our audience. How has the federal budget cuts in mental health recently impacted the industry from your points of view, and where do you foresee it going?
And you want me to answer this one again? Does anybody want to answer that? What I see is, the importance of using everybody at the top of their licensure. So making sure that we have all levels of support, and there's nothing like a peer support specialist or a traditional healthcare worker, or, to be there and be at your side when you need help and that type of thing. But making sure that we have people in the right roles so that when a clinician is seeing you, they're at the top of their licensure. And, if I'm a psychiatrist, I'm prescribing, I'm looking at medications, and I'm looking at the severe things happening in your life. And then, you have step down things to support. So I think that we have to get very, very good at utilizing all the different levels of treatment and care that we have available.
Thank you. I really appreciate your response. All right, if that was all of our questions, I want to thank the panelists here for sharing their expertise. We hope to continue this series with more advanced topics within mental health. If we are going to send a survey out, so we would love your feedback to make improvements for future sessions. And please follow our social media channels to stay up to date on future events. Thank you so much for joining, everyone. Have a great night.